So hello everyone, I am Dr. Jeethender Jain, Consultant Interventional Cardiologist at Yashoda Hospital's High-Tech City branch. So we all know that hypertension is the number one killer of all the cardiovascular diseases, not only in India but also globally. So if you look at the statistics of hypertension, almost 1 billion people all around the world, they have been suffering with this hypertension. So according to the statistics, almost 1 in 4, that is 25% of the people, they are not aware they are having an hypertension, and even if they are aware, almost 25% are not being properly treated for BP medications, that is for hypertension. And even among them, even if they take the medicines, almost 30% of the people, their blood pressure is not under control even with multiple combination treatment. So hypertension is of two varieties. One is called it as a primary hypertension, where there is no specific cause for it, and some are called as a secondary hypertension, which constitutes around 10%, where you can't find a cause like any adrenal tumors or pheochromocytoma or renal artery stenosis, which is responsible for uncontrolled hypertension. So if you look at the symptoms of hypertension, most of the people are asymptomatic, that is, they don't have any symptoms. Almost 90% of the people, they don't have symptoms. That's why they go late and they land up in complications. So that is why if you look at the symptoms, some of the symptoms are like headache, giddiness, or sometimes landing with breathlessness also. They are some of the symptoms of hypertension. So the most common modality for diagnosing hypertension is office blood pressure. That is, whenever you go to the doctor's cabin, and if the blood pressure, upper blood pressure is more than 140 and the lower blood pressure is more than 90, you are labeled that as hypertension. So the grading of hypertension is anything more than 140 you call it as grade 1, more than 160 you call it as grade 2, and more than 180 you call it as grade 3 hypertension. So not only the diagnosis but also the treatment is very important in order to avoid major complications like stroke, myocardial infarction, or sometimes kidney injuries also. So if you look at the treatment of hypertension, we have 5 classes of treatment for hypertension. There are various classes of drugs starting like diuretics, calcium channel blockers, ACE inhibitors, ARBs, and so on. So always, whenever the blood pressure is more than 140, a combination therapy with these agents helps us to control the blood pressure to less than 140 millimeters of mercury. So not only diagnosing hypertension, but keeping it under control helps save millions of lives. So thank you.
Like, comment, and subscribe for more health updates.